Alright, so we've been looking a lot at some drugs that we use in immunopharmacology. That's basically the drugs that have an effect on our immune system. So for drugs that have effects on our immune system, we just want to take time and look at the various classifications for them. So for the next classification which we are looking at is inhibitors of lymphocyte signaling. Inhibitors of lymphocyte signaling. Okay, so for inhibitors of lymphocyte signaling, we said that they are immunomodulatory agents. So these are agents that have an effect on your immune system. So they block the intracellular pathways that are responsible for activating and sustaining lymphocyte responses. So these ones, they block the lymphocytes from communicating to one another. Okay, so these drugs are essential for treating autoimmune disease where your immune system is now attacking the body's own cell. Okay, treating cancers and preventing transplant rejection. All right, so key signaling pathways, you have the calcineurin NFAT pathway, the JAK-STAT pathway, the P13K AKT pathways, the MAPK pathway, the NFKB pathway. So we're not here to focus on the pathways, but we're here to actually focus on the types of drugs that fall under this category. So for inhibitors of lymphocyte, we have drugs like what? The cyclosporins and the tacrolimus. Please you pause this and observe where we are talking about their main target and also talking about their clinical use, conditions where you can be able to use them to solve some one or two issues. We have drugs. For me, I'll just be listing only the drugs, right? We have sirolimus, we have the everolimus, we have tofacitinib, we have baricitinib, we have ibrutinib, we have the bortezomib. Okay, all right, so those are the examples of drugs, and here you can actually see the different types of medical conditions where if you apply these drugs, it will help to make things very nice. So this is ibrutinib, this is what cyclosporins. So they have some one or two adverse effects where they can now suppress your immune system. Okay, so initially, you are using them to suppress your immune system, but if they suppress your immune system, there's a risk of you having other infections. Okay, they can be toxic to your organs, metabolic effects too. They can suppress your bone marrow where your bone marrow is not producing adequate blood again. In the stomach, they can cause nausea, they can cause diarrhea, they can cause inflammation of the mucous membranes. Okay, so this is sirolimus. So that's it for this category of drugs. So we'll keep talking about the categories, and when we're done, we'll talk about the pharmacology of each of the drugs.